over now to Moyne Norm, because he's responsible for getting this together tonight. So, Moyne Norm.
Thanks, King Lloyd Max. Good evening, everyone, and welcome to this special presentation on diabetes awareness. November is designated as World Diabetes Month, and our district, N3, have been having diabetes presentations ever since 1st November. We would like to thank our good Dr. Gabrielle for taking time from her busy schedule to do this presentation. After the presentation, there is an assortment of food for you. Hope you enjoy and learn some things about diabetes from this presentation. Anyway, after the doctor is finished with her presentation, she will take questions from it. Thank you.
Hello everybody. I'm so glad to see you all here again. And today I will talk about diabetes. Diabetes is a big problem in our community in Burgeo, in Newfoundland, and all over Canada. So I would like you to know more about diabetes. It's a very common disease. Anybody is not immune. All of us, we are at risk of having diabetes. That's why the education is important for all of us, whether we have diabetes or we don't. Of course, it's a big subject, and today I'm not going to talk about particularly any one patient. I'll talk in general, but today it doesn't mean you don't need to go and see anyone if you cancel an appointment with your diabetic nurse practitioner, because one of the patients told me, should I go to the nurse practitioner as long as I'm going to attend the lecture? I said, no, this is not part of your treatment. And the treatment of diabetes should be tailored to each and every patient according to his condition, according to his complications. I will sit, and I hope you enjoy it and you will listen here. We all know that diabetics are naturally sweet. Diabetes, it's pronounced diabetes and not diabetes us, because we refuse to let it beat us. Managing your diabetes is not a science, it is an art. And it is really an art because it's the combination of the medicine, of the diet, and of the exercise that suits each particular patient. What are we going to know about tonight? We are going to learn about the origin of the term diabetes, the diabetes history, diabetes in Canada, in Newfoundland, what is diabetes mellitus, what is going on in diabetes, what else can affect your blood sugar, what do a diabetic patient feels, what are the consequences of diabetes, and 5 points to fight diabetes. What do I recommend to you as a diabetic patient? And diabetes and the Burgeo community needs, so we might be able to find something we can help the community here. And we will have some fun with diabetes and then the end. So the origin of the term diabetes mellitus, the dia comes from a Greek word called through, name meaning through, and betes meaning pass, and mellitus means honey. So pass through honey, because people, they pee sweet urine. The history of diabetes is very old. It's back to approximately 1550 before Christ, where it was mentioned on an Egyptian papyrus that it causes the patient to lose weight rapidly and urinate frequently. Indian physicians around the same time identified the disease and classified it as Madhumeha or honey urine, noting that urine would attract ants. In 15 Anno Domini after Christ, the Greek physician Aratus described what we now call diabetes as the melting down of flesh and limbs into urine. From then on, physicians began to gain a better understanding about diabetes. Centuries later, people known as water testers diagnosed diabetes by tasting the urine of people. If urine tasted sweet, diabetes was diagnosed. And to acknowledge this feature, in 1675, the word mellitus, meaning honey, was added to the name diabetes, meaning siphon. Until the 1800s, the scientists developed chemical tests to detect the presence of sugar in urine. There is something we should all be as Canadian proud of, and me as Canadian to be, that there was a Canadian scientist, his name is Frederick Banting, and his student Charles Best, who discovered, they are from University of Toronto, who discovered the insulin for the first time in 1921 and 1922. They gained a Nobel Prize for that, and they refused to make that thing patented in order to get a better price for the patients, and they saved the lives of diabetic patients all over the world. Banting is honored by World Diabetes Day, which is held on his birthday, November 14th. So 1 week ago, we all celebrated with World Diabetes Day. Diabetes in Canada, more than 20 people are diagnosed with the disease every hour of every day. So you can imagine that every day, 480 persons in Canada, they are diagnosed with diabetes. In 2015, the number was 3.4 million, that's 9.3% of the population of Canada. After 10 years, in 2025, they will be 5 million or 12% of the population of Canada. So the cost increased by 25%. In Newfoundland and Labrador, the statistics says that 47,000 people in Newfoundland and Labrador have been diagnosed with either type 1 or type 2 diabetes in 2010. That is 9.3% of the population. And this number is expected to increase to 73,000 of the population of Newfoundland and Labrador on 2025. The economic burden of diabetes in Newfoundland and Labrador was 254 million in 2010, and it will be 322 million by 2020. So you can imagine how much does it cause diabetes and how much we should work on to prevent diabetes or to delay the occurrence of diabetes. So what is diabetes mellitus? It's a chronic illness. Unfortunately, until now, there is no complete cure of diabetes, but we can help a lot to minimize the burden of diabetes on patients. It has two types, one which shows usually in children and teenagers, and two usually type 2 in adults, and it can happen at any age, but mainly after the age of 40. If it is not well controlled, it will turn to be a multi-organ disease. Diabetes can affect any organ in the body: the kidney, liver, stomach, heart, blood vessels, genital organs, eyes, skin, muscles, bones, and also can cause mood disorder. So here we can see the heart. Patient with diabetes is more liable. I don't want you to get frightened after my talk, but the patient with diabetes, he will be more at risk of heart attack, especially if not well controlled. If it is well controlled, he has the same risk of a patient who has no any diabetes. So the risk of heart attack will be more, the risk of stroke will be more, clot on the leg will be more, kidney failure will be more, diabetic foot will be more, glaucoma in the eye, cataract in the eye, and again the retina will be damaged, and here there will be what is called peripheral vascular disease or decreased blood supply to the lower limbs. That's why they feel the lower limb is cold and they cannot walk only for short distance. What's going on in diabetes? So what's going on? We eat, and each cell needs fuel, and the fuel of the cell is glucose. So anything we eat, it should become a glucose. The glucose cannot have access to the cell to feed it only with the use of insulin. So the carrier of glucose to enter body cells is insulin. Now in diabetes, insulin is either unavailable or very little in amount, or body cells are resistant to insulin. So therefore what happens, glucose stay in blood vessels and damage the blood vessels. I can say, like, just when you put some metal under the rail, it gets oxidized and the colors change. The same thing when continuously the blood vessel exposed to high amount of sugar, it will get oxidized. That's why we look in our food to eat antioxidants in order to balance that effect. So cells stay hungry when the glucose stays in the blood vessels and damage the blood vessels, cannot enter because there is no insulin or insulin is not working well. So cells stay hungry. Cells want to survive. They trigger other ways to get food. So they go and break down the muscle, the liver, the fat, and then in order to get energy for the cell. And here a complicated process happens inside the body where there will be muscle breakdown. That's why they feel fatigue. When their sugar is high, they feel fatigue, the muscle is tired. And with time, they might lose weight. And of course, the bone will be less, the muscle will be less, all organs will decrease in size. Now, this is a normal situation. This is our pancreas, which secretes the insulin. So the green things here are insulin. This is the sugar, and normally the insulin carries the sugar, as you can see here. The sugar is connected to the insulin, and this is how insulin moves glucose to cells, and our body works well. In diabetics, there will be less insulin or no insulin, and there will be less amount of insulin combined with glucose and entering to the cells. That's why the patient with diabetes, he will eat, but in spite of that, there is no food to the cell, and the body will tell him that he is hungry. That's why he eats and eats. Again, here, this is the same. This is the digestive system, and it contains glucose. Glucose goes to the blood vessel, and this is the pancreas, contains the insulin, and the insulin goes to the blood vessel. And normally the insulin combine with the glucose and go to the cell. But when we have diabetes, glucose cannot get into the cell of the body, and glucose builds up in the blood vessels. Another one, this is a diabetic patient, this is the digestive system, this is the glucose in the digestive system, goes to the blood vessel, and then the insulin from the pancreas goes to the blood vessel. They combine, they try to go to the cell, but glucose unable to go inside the cell because the cell, this is mainly in type 2, cannot be feeling the insulin. There's some defect in the insulin where the cell cannot feel it, so the cell stays hungry. What else can affect your blood sugar? It's not only your genetics and the problem of insulin. There are many other factors that can contribute to increase in blood sugar. Overweight. Whenever we build up fat in our body, the insulin resistance will be more. That's why we recommend that patient to try to drop a few pounds. Even if they drop 5% of their body weight, it will do magic to the control of their blood sugar. High blood pressure, the same way. It affects the blood vessel, and both of them, they can contribute. Diabetes can lead to high blood pressure, and high blood pressure can lead to diabetes. Excessive alcohol intake. More calories, again, it damages the liver cells, it affects the sugar metabolism of the glucose in the body. Medications, some medications like steroids, people with asthma, with the chronic obstructive disease who are on steroids, women who use birth controls, this can increase the blood sugar. Stress. Stress in itself, when it is persistent and for a long time, it can shoot blood sugar. Infection. Any infection in the body can worsen blood sugar. And of course, again, people who are diabetic are more liable to infection. Therefore, we have to treat the infection and control blood sugar at the same time. Smoking. Smoking is very bad to the diabetics, and it gets the diabetes much more worse. That's why we advise to quit smoking. High cholesterol level, high cholesterol and diabetes, both of them in the same cycle of metabolic illness that affect the body. So whenever there is high sugar, there will be high cholesterol and vice versa. Sedentary life, sitting of the chair, probably the chair is not our friend, it should not be our friend anymore. We have to move as much as we can and sit very little. Many patients, they say we have back pain, we have knee pain. Again, I would, and not me, it's just the medical community would advise people, whatever they have, they can move. Even if they are sitting on their chairs, they can do exercises while they are sitting. What do a diabetic patient feels? You might feel nothing, though you are diabetic. And this is an unfortunate patient, because if you have signs and symptoms, if you come and complain and say, and we do a test, it will be discovered early. Many people, they don't visit the clinic, don't visit the doctor, and all of a sudden they say, oh, we feel well, we have nothing, we are going to the wood, doing everything, but all of a sudden they are discovered with diabetes, which is going on for some time. You might feel low blood sugar. The first presentation of diabetes might be sudden onset of loss of consciousness, coma, patient brought by ambulance to the hospital, low blood sugar, and then with further investigations, we find that the patient is diabetic. Of course, low blood sugar, as all you know, is more dangerous than high blood sugar, and patients with diabetes should be very careful about low blood sugar. Increased thirst and increased urination, so they go to the washroom many times, feel fatigue, muscle weakness, headache and blurred vision, feel sick, throwing up, loose bowel movement, belly pain. Many times, patients come thinking that they have gastroenteritis, and the symptoms of gastroenteritis can be similar to high blood sugar. They come complain of abdominal pain, loose bowel movement, feeling sick, throwing up, and then we find they are diabetic, or they know they are diabetic but they have very high blood sugar. Numbness of the feet, pins and needles. Pins and needles, again, excessive exposure of the nerves will lead to sensation of pins and needles, especially when it is poorly controlled blood sugar. And that's why people with diabetic, they might be at increased risk of fall, because when they put their foot on the ground, they cannot feel it well. Their sensation is impaired. Sexual problems, again, this is part of a big important part, because sexual organs are full of blood vessels, so damage to those blood vessels might lead to sexual problems. Repeated infections, skin, urine passages, and vagina. They might present with any one of those: repeated skin infection, vagina in the woman, and urinary tract infection. Depression. Depression can be a presentation of diabetes, and it can be a consequence of diabetes. Here we can see this gentleman. He is tired and yawning and feeling fatigue. He goes to the washroom a lot. He is losing weight and his pants is getting wider, skin infection, sexual problems. If a woman gets vaginal infections, lots of drinking a lot of water, and the feet feels numbness. And here we have blurred vision, and he feels hungry all the time and eats a lot. Diabetes and depression. There is overlap between the symptoms of diabetes and depression. A depressed patient can feel fatigue, and a diabetic patient can feel fatigue. Disturbance of the sleep cycle in both of them. Loss of concentration in both of them. That's why diabetes could be presented as depression, and it could be a complication of diabetes. Depression could be a complication of diabetes. What are the complications? Again, we will go again, I will repeat it again because they are very important, because sometimes the people, they feel, oh, it's only high sugar and I can manage on my own. Lots of people, they are with diabetes for many years, but they think they can manage it at their own. But of course, we try at the beginning with diet and exercise. This is the best without medicine. But if we cannot, it's better to go for medication. So the complication, if we don't treat diabetes properly, will be kidney failure, heart attack, brain stroke, loss of vision, clot formation, could be in the upper limb, lower limb, or the lungs. Loss of sensation on the feet, resulting in recurrent falls, marital breakdown, loss of job, rising medical expenses. They need to pay more for their medications, unfortunately, and depression. The 5 important points to fight diabetes. First of all, diabetes awareness, symptoms and causes. Everybody should know what is diabetes. It's a risk around us. Like, we want to know about global warming, what's affecting our life and our future. And this is also important for everybody to know about the symptoms, like what we heard a while ago, and about the causes and what might contribute to diabetes. Testing blood sugar levels and or hemoglobin A1C. Many patients, some are aware of what is hemoglobin A1C. It's a very intelligent test. I call it intelligent test because if I will do it today, I would know how was my sugar controlled during the past 3 months. So I would have an idea how was it controlled. because sometimes the patient might come on that morning, he knows he's visiting the doctor, he just made a good diet the day before, and he comes with normal sugar, while on the normal days his sugar is high. So hemoglobin A1C is very important. It will tell us during the past 3 months how was blood sugar. And for blood sugar, we recommend all people from age of 40 and above to visit the doctor and get checked their blood sugar, whether by fasting blood sugar or by hemoglobin A1C, in order to determine who is at risk, who is in a pre-diabetes stage, to give some advice and to try to push diabetes far away from him as much as possible. The third thing is the diet planning. Diabetic patients should go on a diabetic plan, which is something between 1,800 to 2,000 calorie diet a day. Of course, this should be, as I said in the beginning, it's an art. You need to manage your exercise, how much do you move, with your diet, with your medication. Because if you will take 2,000 calorie diet today, while you went to the wood, you did a lot of exercise, then you might go into low sugar. So you need to reach to the state that you know when you do more exercise, then you need to get little more calories to avoid low sugar and keep your sugar well controlled. Fitness for diabetes is very important. Fitness and exercise for a diabetic patient is just like he gets a shower every day. He should do his exercise every day, in a way or in another. We warn patients, especially during the winter, from going out, from slipping. So try to find a way. We will talk about later on about the community, what we can avail of the community. But try to find a way to be, it's not only the homework. Many women, they say, oh, I clean, I do everything. Our houses are small, whatever they are big, and any house can be cleaned every day, only spending 2 hours, and it will be very well cleaned. So you need to go for more harder exercise. Walking is excellent during the summertime. The winter might be a problem. Still, we have to find a way how to do exercise for everybody, and especially for diabetic patients. Adapting to medications. We have many drugs that we can use to diabetic patients, but not necessarily that all patients are the same. Some patients might like one drug, the others might be better with a different kind of drug. Usually we start with metformin, and many patients, we start them with metformin, give them refill for 3 or 6 months. They will come later, they will say, oh, I stopped it because it gave me diarrhea. And for 6 months now, their sugar is high, shooting up. They didn't come back because, they didn't like the diarrhea. If you don't like the medicine, if it doesn't suit you, come back. Say, I don't like it. So we can find another solution, and we have many choices that we can give to you and control your sugar. This is the diabetes food pyramid. You can see here at the base, these are the carbs. Of course, we eat the carbs. This is many kinds of carbs, but we have to be, again, limited on them. We have the vegetables, we have the fruits, we have the meat, so we go less and less until the top to the fat. What do I recommend to you to do? I would recommend visit your family doctor regularly. Keep a notebook to record your home blood sugar values and write how are you feeling, and bring the book with you when visiting. It's very important to keep what you are feeling, because sometimes you come, you are in a hurry, you forgot, you miss. You might felt low sugar a week ago, But if you didn't write it down and then you came to the doctor and the doctor is busy that day, he didn't ask you about lows, he wouldn't figure out that you are developing low sugar, and then you might miss some advice or some modification to your medication or to your diet. So it's very important to keep a notebook and write your blood sugar readings also. It's very important to write them down and bring them with you. Aim at minimum of 30 minutes of active workout, most days by walking, gardening, or doing yard work. Exercise until you sweat, until your heart rate goes fast, until you breathe deep breaths. Retrain your brain and your taste buds with healthy food. I know we all used to have more fat food before we were aware of the risks of high sugar and high cholesterol. But nowadays, to protect ourselves, and because we want to live more years with a quality kind of life, so we want to retrain our brain. So we have to, at the beginning it might be difficult, it will take 1 or 2 weeks to use to the tea and coffee without sugar, but then it will be fine. Then probably if you will put sugar, you won't like it. It's just a matter of train your brain to the new kind, healthy kind of diabetic food. And it's the healthy food. It doesn't mean that it is for sick people. This is the kind of healthy food that all people should eat, and especially diabetic patients. Eat vegetables, pick from rainbow of colors, available to maximize variety and non-starchy vegetables. So try to eat different kinds of colors, the purple, the red, the yellow, the green. That will be very rich with the antioxidants that protects your blood vessels. Eat fruits in moderation. Fruits are very good antioxidants, but they shoot your blood sugar quickly. So you need to be very limited on the fruits, and you need to eat different kinds of fruit. Like every week you can change the type of fruit as available to you or in the market. Choose whole grain foods over processed grain products. And the whole grain, as you know, the brown bread and the whole wheat is very beneficial because it keep your satiety. You keep full for a longer time when you eat the whole wheat bread than when you eat the white bread. Include dried beans and lentils in your meals. They are very healthy to your sugar. Intake fish. I know Newfoundlanders, they eat a lot of fish, which is a good thing, and 2 to 3 times a week. And when you eat the chicken and turkey, please remove the skin before cooking, not after cooking. Is that okay? Or hard? At the beginning, I felt it's hard too, but now I'm used to it and I cannot cook it with the skin. Yeah, okay. Use low-fat dairy such as low-fat milk, low-fat yogurt, and low-fat cheese. Cut back on high-calorie snack foods and desserts like chips, cookies, cakes, and full-fat ice cream. These are a lot of diabetic patients, unfortunately, their snack, they might eat healthy, but the snack contribute to a lot of damage to their blood sugar. So this is the plate, the recommended plate, which is 9-inch in diameter. So your plate should contain 1/4 of starchy, veggie, and whole grains, and those, they raise blood sugar because you need sugar, you need energy to your body. So 1/4 is starchy veggie, and then meat and other protein, the other quarter, and half of it should be vegetables. Diet, patients, when I ask about diet, many of them, not all of them, of course, they don't eat vegetables. They say we don't like it. I hope that Train, again, it needs just training. Try it, enter it in small amount, and then day by day, you will like it and you will feel how much it will help your blood sugar. What do I recommend to you to do? Now we'll continue on that. Eat frequent small meals rather than 2 to 3 big meals. It's very important to eat every 2 hours. Because if you will eat between breakfast at 8 o'clock and between 12, if you eat a small snack, then when you come here, you are not going to overeat during lunch. And the same thing happens in supper. So eat 5 or 6 small meals, better than you go for 1 or 2 meals. Some people, they tell me they are really on 1 or 2 meals a day. The second one will be very big. Am I right? Okay. Keep yourself busy. Keeping yourself busy is again one of the key factors in controlling your sugar. Either work, find a work, something, or volunteer, help somebody else, and avoid filling your time by looking at what you have in the fridge. Because people, when they sit home, and this is really everybody, if I will sit home, I will eat more than if I, on the day when I go to work. And this is something natural. So try most of the time, though you are retired, make yourself plan your day. Like when you wake up in the morning, say, what am I going to do today? I have to do this and this. Find something. I'm sure you can help somebody else. And by the same time, you are going to help yourself. Stop smoking. If you cannot do it alone, come to us, we can help you. We can give you something to help you stop smoking. Drink alcohol sparingly. I know it's difficult, and people have used to drink a lot of alcohol, but again, try to minimize. The more you minimize, it will be better for your blood sugar. And try not to make alcohol like part of your daily activities. Like sometimes people who are retired, they try to find, they need to do something. So they might eat or might go for alcohol, which is again, would not be very good for their health and blood sugar. Avoid stresses. Try to avoid stresses. People in Newfoundland all over, they are pleasant people, they like the joke, they dance, and they like fun, they love fun. But sometimes people have anxiety. Anxiety is an illness. It's just like diabetes. Diabetes, patients have no enough insulin, and anxiety, people have no enough serotonin. So sometimes anxiety is mild, and you might be able to control it by certain actions you do yourself. But many times anxiety cannot be controlled only with medications. Many patients who have real anxiety, they avoid medicine. And of course, it's not only medicine for anxiety, it's the talk therapy. So we recommend talk therapy a lot. So if you have such a problem, you can come, you can say it, you can discuss it. Don't feel afraid of saying that to your doctor. Anxiety can lead, if not treated well, because it will raise the adrenaline in the body, it will increase the stress, and it can lead to diabetes, it can lead to high blood pressure. So anxiety should be controlled very well. Sleep 6 to 8 hours per night. Ask for treatment of sleep disturbance. If you are unable to sleep well 6 to 8 hours, I know everybody might one night have something in his mind, something in you, in his life, so he cannot sleep. But if this happens for weeks and weeks, then it should be treated. So come and ask about treatment. Make sure that your other medical issues are under control. It's very important to treat at the same time your blood pressure, your thyroid function, because our body works as one unit and everything should be perfect, so in this way you can feel well. And then your sugar can be well controlled, blood pressure be well controlled, and you feel well and happy, and you can sleep well. Look after your feet. Being a diabetic is very important to look after your feet. Inspect it, look at it. I'll talk about this after a few seconds. Wear comfy shoes. Drink water throughout the day. It's very important to drink water, but I would recommend you not to go and drink like 2-3 glasses within 2-3 minutes. No. Try to use it as sips of water. All over the day, the bottle with you, and drink sips of water so you don't overload your kidneys with a gush of water all of a sudden in the morning or in the afternoon. Watch your body weights. You will discuss this with your diabetic team. Of course, with patient, it's not only the doctor who treats the diabetes. It's a team which is composed of the patient himself, the doctor, the diabetic nurse, the public health nurse, Darlene, Joy in the clinic, the ophthalmologist. All this team helps to control your sugar and control your possible complications of diabetes. So you need to discuss about your weight with one of the members of your team and can get help. The dietitian, for example. Check your vision regularly, very important. Diabetes badly affects the eyes, so you need to look after your eyes and go regularly for eye check. Keep regular appointments with the doctor, with the public health nurse, with the diabetic nurse practitioner, with the dietitian and eye doctor. Wear a bracelet that says you are diabetic, especially if you go alone. If you drive alone to Corner Brook, if you go somewhere, you walk alone, you go to the park, and if you are diabetic and you walk alone, so it's better to wear a bracelet that says that you are diabetic. God forbid, if you lose conscious for a reason or another, then somebody will come and help you quickly. They will find that you are diabetic. Carry a few candies with you wherever you go. It's a must. If you are diabetic, to carry some candies, but don't eat them unless you have low sugar. Okay? Carry your list of medications with you wherever you go. It's very important. Wherever you go, in your purse, you have a list of your medications. We have at the clinic some small cards. You can ask for them and you can write all your medications are on them. So whenever you go anywhere, if somebody would need to know what are you using, because you might travel and meet another doctor who don't know about you, there is no information, or it's important to have your medication listed in your purse, especially being diabetic. This is diabetic food. Many patients, as we said, because the sensation will be lost on the feet, and many patients they don't feel they don't feel pain, and sometimes they are trying their food, and the wife will tell them, "What's this on your food?" And then he will say, "No, I don't know. What is it?" And then he comes, and we find that he is having diabetic food, a big wound on the food, which takes a long time to get healed. Food care is very important. You have to wash your feet, dry your feet well, keep the skin soft by moisturizing, inspect your feet every day. You can see there's a mirror so you can see the food if you have nobody to help you and look at your food. And ask your diabetes care team about how to take care of your nails, and wear clean and soft socks. And keep your feet warm and dry, and never walk barefoot, and examine your shoes every day. Check if there is any stone or anything inside the shoes. They might harm your foot and give you a wound on your foot. So, and take good care of your feet and use them. A brisk walk every day is good for you. A brisk walk. Alright? Again, I'm repeating the 5 points to fight diabetes. It's the awareness. We need to know this risk around us. We need to know the symptoms of diabetes and the causes of diabetes. We need to check our blood sugar regularly. Go to the clinic, it's free, you can reach it, it's close to you. So go at least once a year. For those who are not diabetic, once a year. For those who are diabetic, probably you need to go 3 or 4 times a year if your sugar is controlled. If your sugar is not controlled, you might need to go every 2 to 3 weeks. Okay? Now, dietary planning. Diet is a big subject. Now, you will learn about it from the dietitian, from the diabetic nurse. You might hear from your doctor. You might do your own search and know about it. We will talk about the internet search now. Fitness for diabetes is very important. Fitness is very important. Exercise, as I said, is just like your shower every day. Exercise is very important to keep your sugar well controlled. Adapting to medications, you need to come and say, okay, I'm not happy with this medicine, I couldn't take it. I don't want you to feel desperate. Sometimes the sugar, of course, diabetes starts at certain age, like for example at the age of 60. And you will be started on metformin, 2 tablets a day. It's a progressive illness. With time, you will need more medicine. You might need the metformin to be increased. The next step is we will add glyburide to it. Then we might add another thing. Then we might tell you, okay, this is not enough. We have to go to insulin. So we have, the aim is not, no, I want to use only one medicine. There are too many medicine on my medication list. The aim is to keep your sugar well controlled. This will keep your blood vessels in healthy shape, and it will protect all the organs of your body. Because diabetes is a disease that affects all organs in the body. There is no organ in the body which is immune to diabetes. Now, diabetes and tubercular community, the needs. Now, I felt that these are, but you might feel something, and again, this is open to your discussion. We need enthusiastic people who promote exercise on a wide scale. I know this is available among the women. I know Glenda and Suzette are running aerobics, another lady, she's running walking videos, Terry is running the Zumba classes for the women. I wish that more women are joining those classes. But at the same time, the men, still there is, I hope if someone who feels himself able, who can step and guide similar thing and make this available to the men, because it's very beneficial to the health of the community. The second thing is gymnasium in the community. I know we might feel it is, but I will tell you in one of where I was working, there was a small place which made as, I will say that to the Lion Club, they might think in the community that you might be able to see that it could be available, or the town probably they might be able to avail that. There was a small room, and I think there are 2 treadmills in that, and there is no need for a person to stay 24 hours. People usually go get an electronic card, and they pay $10 or $15 a month, and they can go anytime with the electronic card. They enter, they go for 1 hour, for example, do the on a treadmill an exercise, and then they go out and close the door. So this might be an idea, or you might have another different idea. Somebody might step and say something different again, but I feel because not everybody can walk outside, people might prefer to go indoors, especially in the winter time, so they can do their exercise. Now, access to internet. Internet is a very important source of information. I agree it might be expensive to some couples. They are retired, they don't use it a lot. But if they want to know about their diet, nurses, they need to go, it's very easy to be used. So if there is a possibility, like in a cafe, the cafe in the town, if there is like an access to internet, and they can go pay a few dollars, and then they can have access to the internet, that would be, again, a possibility that they can get more information about their diabetes, diet, probably they might get some recipes to cook, healthy recipes, rather than they do whatever they used to do every day. Of course, education of the kids at school about diet and exercise, and this is, I think this is our responsibility. We might do something to the school in order to educate the kids about the importance of diet and exercise, because everybody is at risk of getting diabetes. Now the last one, encourage the food supplier of the community to provide more variety of greens, vegetables, and low-fat dairy products. We hope that if they can provide more varieties, and again, it's our responsibility to buy more from him rather than go to Corner Brook and do our grocery from there, so we encourage him in order to bring the healthy kinds of food to the community. Clear to you, or did I speak fast? Was it clear? Did you expect this, what I said, or you didn't expect what I said? Did you expect what I was saying, or you expected something different? No. Okay. So what about if you, I don't know, this is, I will leave it to the leaders in the community, probably the town hall and you, the Lion Club, about the possibility of availing things for exercise, which is very important. Okay, so I will go on. All right. Now the last part will be, we will have some fun with diabetes. You might hear this from your mom. God sent Adam and Eve out of the garden because of the apple. Apples have carbs, and carbs are evil. When you have just been diagnosed with diabetes, you will tell your friend, I figured it out. Diabetes is such a pain in the pancreas. When someone will offer you sugar, you will say, sugar? Nah, I'm sweet enough. You are diabetic and you go to the bar. You will tell, bartender, I'd like a margarita, a Long Island, 2 beers, and a double shot of insulin. You are diabetic and you are on the road to the airport. Your wife will prepare the diabetic pre-flight checklist. Test strips, meter, your sugar, are you okay? Do you want me to drive? And you have to listen to that every time. When you tell your doctor that you are using Splenda, he will say, you have type 3 diabetes, too much artificial sweetener in your blood. Of course, we do not recommend Splenda. Any sweetener is not healthy to the diabetic. There are lots of studies talk that there are, it could be in the future, different literature comes and it might not be available as it is available and advertised now. So it's better to avoid all sweeteners. When you get counseling by your doctor and you tell him that you are fed up, you would say, he will say, the doctor will say, you can enjoy diabetes, high cholesterol, and hypertension, or you can suffer from good health. So which one do you prefer? Without sugar, suffer of good health, or diabetes, high cholesterol, and hypertension? When you work hard to find a solution for your diabetes, you will say, What's wrong with eating donuts to cure obesity? Don't you believe in alternative medicine? When you are too enthusiastic about exercise while your wife is not. She will tell you, Ernie, will you give it a rest? And you will say, hey, a walk a day keeps diabetes away. And it's true. When you develop diabetes awareness, you will tell your doctor, diabetes has increased dramatically over the past 20 years. That proves that diabetes is caused by global warming. Say always, I'm stronger than diabetes. At the end, diabetes is like a roller coaster. It has its ups and downs, but it's your choice to scream or to enjoy the ride. And thank you, sweet diamonds.
Thank you, doctor, for the information. Great job. Thanks again.